Today's topic is a pelvic floor, also called as pelvic diaphragm. Okay. Now, pelvic floor is a muscular partition which separates the pelvic cavity from the anatomical perineum. Okay. So here pelvic cavity is separated from the anatomical perineum. It consists of three sets of muscles on either side: pubococcygeus, iliococcygeus, and ischio-coccygeus. Okay. So you have pubococcygeus, you have ischio-coccygeus, and you have iliococcygeus. Okay. So these are the three parts, and collectively it is called as levator ani. Now, its superior surface is concave and slopes downwards, backwards, and medially, and is covered by the parietal layer of the pelvic fascia. The inferior cervix is convex and is covered by the anal fascia. The muscle with the covering fascia is called the pelvic diaphragm. So this levator ani muscle, along with the covering fascia, is called as pelvic diaphragm. Okay. Now, what is the origin of this levator ani? Each levator ani arises from the back of the pubic rami, from the condensed fascia covering the obturator internus, that is the white line, and from the inner surface of the ischial spine. Okay, so this is what is the origin of the levator ani. Then what is the insertion? From origin, the fibers will pass backwards medially to insert into the midline from before backwards to the vagina. That is lateral and posterior vaginal posterior walls, then perineal body, anococcygeal raphe, lateral borders of the coccyx, and lower parts of the sacrum. So these are the places where there is an insertion of the levator ani. So the fibers will pass backwards, then medially, and in the midline from before backwards you will have vagina, that is a lateral and posterior wall, then perineal body behind it, then comes the anococcygeal raphe, then comes lateral border of the coccyx, and the lower part of the sacrum. Okay, that is what is the insertion of the levator ani. There are two gaps in the midline. The anterior one is called as hiatus urogenitalis, which is bridged by the muscles and the fascia of the urogenital triangle and pierced by the urethra and the vagina. The posterior one is called as hiatus rectalis, that is transmitting the rectum. Okay. Now, structures in relation to the pelvic floor. The superior surface is related to the pelvic organs. From anterior to posterior, you have a bladder, vagina, uterus, and rectum. Pelvic cellular tissue between the pelvic peritoneum and the upper surface of the levator ani, which fill the available spaces. Then ureter lies on the floor in relation to the lateral vaginal fornix. The uterine artery lies above and the vaginal artery lies below it. Okay. Then you have a pelvic nerves. The inferior surface is related to the anatomical perineum. Okay. So these are the relations of the pelvic floor. Then what is the nerve supply? Again, one of the commonly asked questions. It is supplied by the fourth sacral nerve, inferior rectal nerve, and perineal branch of pudendal nerve, that is S2, S3, S4. Okay. So perineal branch of pudendal nerve S2, S3, S4 is responsible for the supply. Okay. Functions. Support to the pelvic organs. So what are the functions of the pelvic floor or the pelvic diaphragm? One, it will give support to the pelvic organs. The pubovaginalis, which forms a U-shaped sling, supports the vagina, which in turn supports the other pelvic organs like a bladder and the uterus. Weakness or tear of this sling during parturition is responsible for prolapse of the organs concerned. To maintain intra-abdominal pressure by reflexly responding to its changes. Facilitates anterior internal rotation of the presenting part when it presses on the pelvic floor. Okay. Then we continue with the functions. Puborectalis plays an ancillary role to the action of the external anal sphincter. So this puborectalis sling, along with the external anal sphincter, it provides action. Okay, this is an ancillary role to the action of the external anal sphincter. Then you have ischio-coccygeus, which helps to stabilize sacroiliac and sacrococcygeal joints, and it also steadies the perineal body. Okay, so these are the functions of the pelvic floor. Now, what happens to the pelvic floor during pregnancy and parturition? During pregnancy, the levator muscles will hypertrophy and become less rigid and more distensible. Due to water retention, it swells up and sags down. In second stage, the pubovaginalis and puborectalis relax, and the levator ani is drawn up over the advancing presenting part in the second stage. Okay, so there is a relaxation of this pubovaginalis and puborectalis, and the levator ani will be drawn up over the advancing presenting part in the second stage. And if it fails to happen, that is a failure of the levator ani to relax at this crucial moment, may lead to the extensive damage of the pelvic structures. The effect of such displacement is to elongate the birth canal, which is composed solely of the soft part below the bony outlet. The soft canal has got deep lateral and posterior walls and its axis in continuation with the axis of the bony pelvis. Okay, so that finishes the pelvic floor.